Hey there. I want to show you just a couple things about the knee. I've heard a couple people complaining of crepitus or kind of creaking or cracking when the joint moves. The joints are kind of supposed to be self-lubricating and they normally stay that way as long as there aren't any restrictions that are either pulling them left, right, front, back. And that when you move, they're able to sort of compress and decompress. It's supposed to be a self-healing and a self-lubricating system. What gums it up a lot of times is just adhesion that can be created over time and stress. So one of the things that I'm going to show you real quick is just how to mobilize the patella slightly. First thing you might want to do is warm it up just a little bit. You can either warm it up by hand or you can use a massage gun that's kind of around the area. And when I say around the area, you might also want to go into the calf a little bit because that's definitely part of the stresses that are placed on the leg. Also to the peroneus longus and brevis on this particular side and deep into the soleus. Loosen things up a little bit. For some of the work, sometimes I'll use a little bit of evil bone water ahead of time. I don't really use any oil or any balms when I work the knee initially because you don't want too much glide. You want just a little bit more kind of grip. So as soon as this sinks in a little bit, first thing that I'm going to do is just very gently around the patella, work it with my fingers. Same thing other side. See if I can get a little bit of movement out of it. And movement front to back. Now, some people worry about this. You're not going to detract your own patella. If your patella goes out really, really easily, maybe it's possible, but for the average person, even with an unstable patella, you're not going to be able to dislodge it yourself. So a little bit of up and down, front to back. I've got a little restriction here. You can see how it doesn't really want to push to this side, so I'll probably work on that just a little bit more. There's one more stretch that you can do that's an odd one that will help tremendously. And it's trying to get the lower portion of your leg to move into internal and external rotation. Now, the knee is supposed to be a hinge joint, so it's not really supposed to do this range of motion. But it's restricted in a ton of people, and it's what provides our pivoting ability. So if you can get that range of motion working a little bit better, it's going to improve your knee health, decrease crepitus, make it so that you can do a much more full squat if that's your goal. Anyway, I hope that helps out just a little bit.